So in Tennessee, we have an in-depth person-centered planning process that we use to develop plans for people with intellectual and developmental disabilities. And it's a really thought-out process that we go through to make sure that nothing is rushed, we get everyone's input, that we are making sure we capture what's important to and for a person. The end result is a really solid plan that is focused on the person and what they need and want their supports to look like.
A person-centered support plan is basically a map of the person's life and where they want to go. And then we take that plan, we add as much detail as we can into it, into all areas of their life, their home life, their community, their desire for employment, for volunteering, everything about relationships that may be important to them or relationships they want to acquire. It's a really good starting point for the knowledge of the person that you're working with. The plan also serves the support side. So not just the knowledge of it, but how we are working with that individual based on the preferences and who they are.
So we're excited to be able to move into a new platform for doing that work. And Therap will allow us to focus less on the nuts and bolts and be able to use a uniform platform to communicate with all the people that are in the system in one place. Instead of sending documents individually all over the place, there'll be a single place to be able to house that information that people can access and be able to reference back in real time what the person's plan is and what's the most current information.
You know, if there's ever any question about what to do or how to provide the service or what does this individual need, the answer is in the plan. So having that plan in Therap means that anybody can access it from anywhere. And that anytime it gets changed or updated or a new plan is added, that gets prompted to the staff to see that and acknowledge that. There's no more, oh, I didn't know, nobody told me, because the plan is right there for everybody to see.
When we are starting the pre-planning process with an individual, we typically start anywhere from 90 to 120 days out. We meet with that person, we talk to them about what their vision is for their preferred life. We do a number of assessments with them, and we work with them to figure out what outcomes will help meet that vision. And then we incorporate the providers into that.
So it really helps us to get that pre-planning document and add additional input in there, add additional things that person may want to achieve this upcoming year. Maybe they have a goal of learning how to drive, get a driver's license, that kind of thing. So it really helps the agency with that pre-planning process to make sure that we really capture that individual's wants and needs before the actual meeting.
In the pre-planning process, some of the information that we exchange from the support coordination side with the provider network and the family are things like what their support needs have looked like in the past year. We usually collect sleep data and behavior data and activities, and we develop goals and outcomes, and we're monitoring those. And so there's the pre-planning process is kind of an assessment of all of those things. How have they gone for the last year? What do we need to tweak and change to move forward? And so that information will, right now is done through email and conversations and different touch points along the way. And Therap will give us a platform to house all of that information directly. And
so being able to see that draft before it gets approved, before it becomes the plan, and put any input in that. If we notice something that's terribly incorrect, we can get that input to the case manager or the ISC before the plan goes into effect. And so I think overall it would just really help the efficiency of getting the plans in place in a timely manner.
The direct support professional is very important. They are the person who works directly with that person, the boots on the ground. We want to get their information, we want their input.
A lot of times the provider that's in the home with the individual, the DSP or whoever might be present for that, they also are giving us information that helps us better know what the person's needs are, because that provider is with them day in and day out. And a lot of times they're sitting there with you when you are working through the tools. We have different assessments like the individual experience assessment and the employment data survey that we work through annually during the pre-planning process, and that helps us work. The individual, the DSP, is there to help support the individual in the answers that they're giving and the perspective that they give.
The direct support professional is the one that is working with that individual day in, day out. Your management team, the case managers, even the person's family, they're not with that individual daily. But that direct support professional, your lead DSP, overnight staff, those are the ones that truly know what that person's needs are, what their goals and aspirations are. So it's absolutely critical to make sure that those direct support professionals have input, provide feedback in that plan, say, hey, this goal isn't working. We have been trying to get a driver's license, or we've been trying to make our bed for the last 2 years, and guess what? It's just not working. Let's come up with something that's more person-centered for this individual, something that they actually want to do and accomplish.
The pre-planning process kind of culminates in the annual ISP meeting, and that is when all of our key players come into a room together to talk about the plan, to finalize it.
At that ISP meeting, we're sitting there talking with the person. We love it when the person is able to lead that meeting for us.
We have the discussions about what is important to the person, what is important for the person.
Finalize those outcomes that the person wants to work on for the year, and to make sure that we have captured the most accurate information possible in that plan.
And then those outcomes that the person developed at that pre-planning meeting, the 90 to 120 day meeting, that's when we start to build some actions to help meet those outcomes. Just little baby steps to help guide them in the process of, I like to think of it as a ladder, and so you meet this, each rung on the ladder is going to guide you to that ultimate outcome.
Tennessee takes pride in making sure that the individuals that we support have an active participation in their plan development, have an active participation in their goal development. So, it really gets the individual supported energized and excited about the next year.
After that meeting, we go back and finalize the person-centered plan, and we add the information that we've learned through that final meeting with the full circle, and then we send that plan to the Department of Intellectual and Developmental Disabilities to be authorized for services. And based on what we've written in the plan, there should be enough information to be able to authorize the services that we are requesting for that plan.
And then we take that plan, and once it's approved or denied or partially approved, whatever it may be, we send that out to the providers. And within Therap, they'll be able just to access it there and acknowledge that the plan has or had some changes made. And then they're able to make their services and supports that they provide to that individual reflect what was approved.
Transparency is key to the success of delivering supports for people with disabilities. It really does take a village, and I think sometimes we forget that whether or not it's an ISC, a case manager, a provider, a guardian, we are all on the same team, and we are all fighting for the same outcome, and that is for a high quality of life and happiness for the people that we support. The transparency of Therap allows us to see that we're on the same team and that we're working towards the same goal.
So we have really looked forward to, for a long time, having a platform to be able to collect data for people using services. And one of the things we're most excited about that Therap will allow us to do inside the plan will be to have a uniform way of talking about a person's risk and how we manage those. The home and community-based settings modifications that we do for some folks, having a uniform place for that, and then having a place to really manage and oversee any human rights restrictions that are in the plan, and being able to kind of have those sectioned off in the plan as their own entity that allows us to focus on those things and minimize them as much as possible. It will allow us to kind of see data across the state over where we may need to provide some additional support or improvement to improve people's quality of life.
Those IC agencies can pull that real-time data, compare that with the monthly reviews they're looking at. So they can see, is this goal working? Do we need to have a follow-up planning meeting to see if we need to change some goals and action steps? They can have an overall picture view of the person's health. Overall, just kind of view of what has been going on in that person's life. Typically, ICs visit and have contact on a monthly basis. This will allow that support coordinator, that case manager, to have more frequent contact if that is needed and pull the data out of the system.
Having access to the plan in real time to see the latest updates is critical. There were times in the past where you would walk into a home and there would be the person would be telling you something that wasn't working out quite as well. And you'd pull up the plan that's in the home and it was an outdated plan because it hadn't trickled through the right people to get into the home. And so a lot of times the plans update all the time. And so if there's not a way to get it instantly, then there's a loss of progress in getting the plan where it needs to go to the people that are providing those supports.
In Therap, I think it'll be a lot quicker because we can SCOM and they'll have it immediately. They can go right to Therap and open that document, review it, make sure their information that they have shared, that the person has shared is in there. The things that we've talked about, the person's vision for their future is in there. Services and requests are put in there kind of again in draft status and hoping to get feedback from them prior to the meeting or at least at the planning meeting as well.
And Therap is going to allow us to do that in a platform where everyone has access to the plan in real time as soon as it has been authorized. And folks will be able to approve the plan in Therap, and we'll be able to understand who's seen it and who's participated in the plan without having to rely on individual email systems and all the things that can break down in that process. It'll be a seamless process to ensure that people have access to the most current information.
Absolutely. As soon as that plan is updated, it's going to show up on the dashboard for those direct support staff. They're going to know that they have a new plan that they have to acknowledge for the person that they're working with. And it goes back to quality of care, making sure that as soon as we receive that plan, we can go ahead and start implementing it. The staff know that there's a new goal that they may need to start assisting the person with, they need to start documenting on. Previously, it was all on paper documentation that we would have to mail out, send to the group home, several copies in the travel binder, in the office book, that kind of thing, and you hope that they're all the same. Having that instantaneously uploaded into Therap makes sure that we're first and foremost following the right plan, the most current and up-to-date plan. And it helps with training staff and making sure that they are implementing the plan accordingly.
The benefit of being able to do it electronically is that there's no waiting period. Once that plan goes through the approval process, everybody has immediate access to it. And so amendments are done frequently for tons of reasons. Personal preference, or a new service is needed, or a service needs to end because they've progressed enough to discharge that service. So the plan being readily available in an electronic database system it's ideal for all parties involved. It's something we've been looking forward to for a long time.
We love our process here. The person-centered support plan in Tennessee is great. So it's not actually changing the plan, it's just more or less changing the storage location for it and the communication that we have with the plan. Instead of it being on paper, in a travel binder, in an office binder, that kind of thing, it's going to have it in Therap. It really, with our provider agency, it has really improved the quality of care that our individuals receive, because instead of waiting on that plan to come out through an email, us printing it off and sending it to the homes, it is instantaneously showing up in Therap on their dashboard that they can look at and see that same plan that they're familiar with.